A very good evening, everyone. Today we have Vaishali Rai, a theatre and a voice-over artist, an actor and event host. She will be the anchor for this program, asking the right questions to the health experts. Let's welcome Vaishali Rai, anchor Wellness Wednesday.
A very good evening, everyone. Namaste and Mabuhay. Welcome to another episode of Wellness Wednesday by Ivy. Ivy, a not for profit organization, provides a platform dedicated to women in enterprise in the Philippines. It aims to empower their entrepreneurial and professional spirit to its highest potential. For one to achieve their full potential, health is important. The Ivy Wellness Wednesday episodes are brought to you as part of our India-Philippines Friendship Initiative. In our mission of creating health awareness every month, we will bring you a well-known medical expert with a brand new topic. All you have to do is ask the right questions in the comment section and we will get the experts to answer them. Our previous episodes were well received, and for those of you who have missed the session, it is now available on our YouTube channel. I would also like to request you, our patrons and supporters, to please share and spread these videos on every social medium possible to help spread awareness. You never know, it could save a life. Today, we bring to you another topic of relevance, vision health. Vision is one of the most important senses of the human body. We perceive up to 80% of impressions by means of our sight, often taken for granted. However, if one loses his or her vision, it would be devastating. So join me today with Dr. Valerie Pesumal Angulo as we speak about common eye problems and preventive care. Dr. Valerie Pesumal Angulo is a certified MD in ophthalmology from Manila. She is currently practicing at Angular Eye Center and is a visiting doctor at CP Vision Araneta Center, Cubao. It is our pleasure to have Dr. Valerie take out some time and talk to us about vision health. Dr. Valerie, hearty welcome to Ivy's Wellness Wednesday. Thank you for coming here and guiding us about vision health. So, Dr. Valerie, earlier having corrective eyeglasses was commonly found being used after, say, 10 years of age. These days, because of the gadget era, we see very young toddlers also needing the help of refractive measures. So what is your take on this? And is this preventable?
So first of all, thank you for having me here. So your question was about gadget use, is that correct?
Okay, that's right.
Yes, actually, so we're seeing right now we're seeing a lot of new cases in children, mostly related to gadget use. So usually, before TikTok and Facebook and all these stuff, we only see like dry eye syndrome in adults. So headaches, what else? Red eyes. But now we're seeing a shift. Now we're already seeing children with headaches as well. They complain of sometimes they see their eyes become so rough. No, they say it's very rough. Their eyes are painful. It's sticky. All these things. They complain about that to their parents, and we're attributing that to the increase of gadget use. All right. So with gadget use, the problem is you're not supposed to focus too long. That's the problem. Okay. So children, when they're reading at near, they tend to read too closely, and it's for a long time. And when you're reading up close, you tend to forget to blink. So normally, the blinking rate of humans in an hour is usually around maybe like in a minute. Actually, it's 20 blinking. They blink for 20 times a minute. Okay, but when you're too focused on something for a long time, you tend to forget to blink. That's normal. That's for everyone. And so when they don't blink, the tears that they produce is also reduced because they don't get to blink often. No? So they don't get to lubricate their eyes. And that's going to push your eyes to be dry. And then all the symptoms like headache and redness, they'll start to surface. Okay? They will start to come about. So that's why we see a wider age group experiencing all these symptoms. Before, back then, it used to be like adults, just those who are working in call centers, or maybe basically everyone who works in front of computers. But now, even children and even elderly. So, so that's our problem with the digital, our culture, our society now. So
That's so true. That's so true. So, all of you out there using your gadget, as Dr. Valerie said, do not forget to blink. It is very important. So,
yes.
friends, our eyes aren't just performing a task, they are a portal through which our brain can tell us about our world, learn new things, and make wonderful memories. All of which are reasons why vision is such an important thing to take care of. And we have the young Dr. Valerie to talk us about this topic. As always, we have gathered today's questions from IB members and our communities. For those of you who are watching this live, if you have a question, do send them here on the live chat below. We will try to accommodate as many questions as possible. If we are unable to answer them during the program, we will get back to you later. We are prioritizing the questions that were received earlier. So without further ado, let us begin with our question and answer segment. So Dr. Valerie, our first question for today is, according to you, what are common eye problems in children, adults, and elderly people?
Okay. So, so it's important to know that eye problems, all of these eye illnesses, they exist in all age groups. So you can see certain illnesses in children that you can find in adults as well, and elderly. But for children, in the clinic, the most common illnesses that I see are, of course, refractive errors. That's one. When they have a grade, they have a grade. I also see amblyopia or lazy eye. Maybe if there's time, I could elaborate later. And then I also see, again, digital eye strain in children. So those are the three most common illnesses. Now, for middle-aged adults, actually young adults, I always see dry eyes. It's very common. Also, of course, conjunctivitis, like sore eyes, since they tend to go outside a lot when they get the virus. Okay, I also see allergies, allergic conjunctivitis, when their eyes just itch repeatedly, over and over. In middle-aged adults, I have to include this. When you say middle age, these are adults above 40. There's a condition called presbyopia. Now, some of you might know it, but presbyopia is actually a disease, not really a disease, a condition where older people are having a hard time reading at near, but their vision is clear at far. So I have to include that because it's very, very common. It's not really a sickness. It's more of a condition that can be treated with glasses. And of course, for the elderly, they have the most number of complaints. But I would put cataract as number one. Cataract, like the lens is opacified. Some of you are probably familiar with cataracts. And I'd also put hypertensive retinopathies, diabetic retinopathies. In that each group, there's a lot already. What else? Maybe glaucoma can come about more commonly in adults. But if you're going to ask me what's the most common, it's really cataract in elderly.
Okay. So since you mentioned about grades or refractive errors, what is the most common cause of it? Is it preventable or is it hereditary?
Okay. So actually, refractive errors are caused by a lot of things. The younger patients usually acquire it because of their parents. It's genetic, it's hereditary, but it can also be acquired if, let's say, they get into an accident, there's trauma to the eye. You can also develop refractive errors. Now, in adults, cataracts, the formation of cataracts can lead to refractive errors as well. And of course, as we grow, our face changes, the shape of our face changes, the orbit becomes bigger, our eyes also elongates, we can also develop refractive errors. Mostly, there's no really prediction of what kind of grade you will get. Assuming your parents have a refractive error, you won't be able to predict if you will have the same degree of grade. It just really happens. But yeah, to make it short, it is hereditary most of the time.
Okay, thank you. Thank you for that. Um, we have someone asking us, what is astigmatism?
Okay. So astigmatism, there are, so before I talk about astigmatism, this is the part where it would be nice to have a diagram. Because we have our eyes, they tend to, of course, the shape of our eyes is a globe. So we have a cornea in front of our eye. That's the one that protects your eye, the cornea. So that's the window of our eye. It's supposed normally it should be, it has a shape. Normally it should be curved, maybe round a little bit. But with patients with astigmatism, they can have very steep corneas or very flat corneas. Okay? So think of a perfectly curved hill, but some patients do not have that. They have a steep hill or a very flat hill. So that's the number one cause of astigmatism. It's the corneal shape. Now, there's also another kind of grade. I have to talk about this also because it will get confusing. Um, Called myopia and hyperopia. So that's different from astigmatism. Myopia and hyperopia, they are near and basically in layman's terms, nearsightedness and farsightedness. Okay? So that's the one that has a grade. Let's say I am nearsighted, so my grade is a minus grade, or I'm farsighted, but my grade is a plus grade. Okay? So that and astigmatism, they tend to exist in most patients, and both of them will cause refractive errors. Um, I'm sure there are some patients who do not have myopia and hyperopia, they just have astigmatism. But that will all, even if you only have astigmatism, that will cause significant blurring. It will cause you to have to see letters are a bit jumbled. That has to be corrected also.
Okay, thank you. Thank you for that, Dr. Valerie. Well, personally, I have astigmatism, so I wanted to ask you that question really.
Okay.
So can an astigmatism patient use contact lenses?
Yes, there are certain contact lenses that can be used by astigmatic patients. Um, they're called toric lenses. However, they're a bit pricey, and of course, contact lenses, they require you to have good hygiene. No? You cannot just purchase one, use it for a long time. So if you cannot tolerate, personally, I recommend glasses for everyone. In certain conditions where your grade is so high, then go ahead with contact lenses. But if you, like I said, if you cannot tolerate astigmatic lenses with your prescription, with your eyeglasses or spectacles, you can go ahead with contacts. But you just have to promise that you will maintain good hygiene. Because that's, again, another problem I see in the clinics. They wear contact lenses, they forget to take it out, they develop.
Right, right. And what do you think about LASIK surgery? Would you recommend it, or is it more of a cosmetic surgery?
Actually, LASIK is actually not just cosmetic; it's very life changing. So I definitely recommend it to patients who have really high grades and are having a hard time wearing glasses. Because when you buy spectacles, the higher your grade would be, you will have a thicker lens. So it's hard for them. It's always heavy. And then the maintenance, so you have to keep on replacing because it tends to scratch more because it's heavy. And of course, aesthetically, it doesn't look as pleasing. So they can go ahead. It's very life changing, but it's not that easy to have late. It's not for everyone because you have to go through. You have to be a candidate first. There's a very strict rule. You have to have a cornea that's not so thick. That's not so thin. Sorry. You have to have very normal. You cannot have dry eyes basically. If your eyes are very dry, then you're not candidate. And of course, age is also a factor for laser.
So you're saying it is not really more of a cosmetic surgery, and you would recommend it?
Yes, for some patients, there are patients who don't really have a grade. They have just a minimal one. They want to go through laser, and it's no problem. That's the cosmetic part. But for me, it's really life changing. It's a very very useful procedure, especially for those with very high grades.
Okay, thank you. Thank you so much. So we now have a question that has just come in, and it is on conjunctivitis or red eye.
Okay.
So, red eye and stye are the most common eye problems. What is the cause of this? Is it preventable and how contagious is it?
Okay. So I would like to, if it's okay with her, I would like to say that red eyes and stye, they're very different. They're not the same. Okay? So red eyes is a general term. You can have, there are like hundreds and hundreds of eye problems that will cause you to have red eyes. Stye is a very specific illness, okay, or a condition. So you can get, red eyes can be viral, no? It can be infectious, or it can also be immunologic. Let's say you have arthritis or a general health condition, you can actually have red eyes. So those are the things that you don't get from other people. Okay? Then you can also have red eyes because you got infected. So I'm sure this is what he wants to know about. The person's asking question. Where do you get it? You can get it anywhere. So there's a virus called adenovirus that you can get from a handshake, from touching surfaces, and you touch your eye. You can actually get it that way. So there's also bacteria. That's the worst. You can let's say it's very rare. Let's say you contaminate your eye with bacteria. You can have a very purulent discharge with a very red eye. And then there's also allergic causes. As I explained earlier, it's very common in young adults. It just tends to itch a lot, and then you get red eyes. And then dry eyes can also cause red eyes. Now, stye is a different condition. That's when your eyelids swell because the bacteria goes inside the eyelids. And then they tend to multiply. They tend to form into a ball. So you can actually see a stye forming. And that's very hard to remove if you wait a long time. You have to remove it right away.
Okay, so is it right to say that both conjunctivitis and stye are caused because of bacteria or they are bacterial infections?
Yes, stye is caused by bacterial infection. Conjunctivitis, again, it's a broad term. It can be a viral cause, a bacterial cause, or even just allergies.
Okay, thank you. Thank you for that. Doctor, we just have a question that has come in about the LASIK surgery, and she asked us that until what age can we do a LASIK surgery?
So the most important part is to know that usually we don't really recommend laser on very young patients because their eye grade is not stable. So their eyes are still growing, their grade changes. So most doctors, LASIK doctors, they start at around 22. Some have higher cutoffs, so 25. So it's not really that specific, but they wait for your eye grade to stabilize because it wouldn't be right to correct it and then it will just change again, right? So you have to have a stable refraction. As for the how up to what age, it doesn't really. There's no real true limit actually to laser. You can have laser at an old age, but it's not usually being done to older ages because they also have other eye problems. So aside from gray, they also have cataracts. They also have presbyopia, as I mentioned earlier. So it's actually one of the last procedures that we suggest.
Okay. Okay, so coming back to conjunctivitis and stye, we have somebody asking us, how can we treat this at home? Is it okay to purchase over-the-counter antibiotic eye drops?
All right. So with eye drops, they're very tricky actually. That's why whenever I have a patient, I would always like to see them in person. The eyes are very small. We need a microscope to check every detail. It's a very detailed field in medicine. You have to check all the little clues because they all look alike. When you have red eyes, they all look alike until you see them in a microscope and you find some subtle signs that will lead you to your diagnosis. So if you're having stye or red eyes at home, you really have to see an eye doctor. There are a lot of antibiotics, especially those with steroids, that may harm your eye if you're not sure of the diagnosis. We look at very subtle signs to differentiate them, and that's why we use a machine called a slit lamp microscope. So for that person, just see your doctor. It's the first thing. Don't buy over the house.
Friends, so do not try and prescribe any kind of medication for yourself. Do go and see your doctor and see what your doctor prescribes for your eye. Dr. Valerie, we have a question come up that is, what is lazy eye and how can it be prevented?
So lazy eye is the layman's term for amblyopia. Okay? So I think I explained earlier that it's a lot of times it's seen in children. So it's when it can be caused by many reasons again. First, refractive errors. Let's say you have a different grade for your left eye and you have a different grade for your right eye. With assume that your right eye is clearer than the left, your left eye will tend to lag. So why does it happen? In children, our brain, our brain develops both eyes at the same time. Okay? So if one eye is not as clear, our brain will tend to focus on making the other eye clearer. It's a survival thing. That's why eventually when the person becomes older, the other eye lags or it becomes lazy, which is why we usually correct it at a young age. So when we see patients that are just children and they have a different grade, we advise the parents to to have glasses already for their patients, and also to do we have this thing called amblyopia therapy. Now we patch the good eye. So assuming like I said earlier, the right eye is the better eye. We cover it for about an hour to allow the bad eye, the poor eye, to train to be able to see better. We if we don't develop it equally, it can be permanent. So that's why it's called lazy eye. It can be permanently lazy.
But if it is treated early before the age of 7, is it completely curable?
Um, well, it maybe not completely curable because it will really depend on the grade. So there are patients with severely different grades, no severely. At least what we do is we treat it as best as we can to make the grade closer to each other. And then if ever at 7 there's still some refractive errors, let me just continue the glasses. But they're also, sorry, I have to add, they're also acquired causes. You know, like if when a kid gets into an accident, injures one eye, that can also cause lazy eye because the other eye will not develop as well as the other one.
Okay. We have a mommy here who's asking, how often should children be taken for regular vision screening?
Okay. So in my clinic, I recommend as well, by the book, actually, it says that when a child is at a school age and can read, you have to start bringing them to the opticals or the eye clinics. But I recommend even as early as 1, I check on their eyes already just to check the health of the retina, maybe to check for cataracts. Even younger patients, I welcome 6 month old babies just check if they have problems. But it's really required for a child at a school age to have vision screening before they go to school. It's really a must because most parents do not do that. They just find out in school that the kid has problems. Especially if the kid can read already, then bring the kid to an optical or an eye clinic, then have him just check the vision. It's so important to again diagnose them early so you can correct their vision, prevent lazy eye from happening or uncorrected refractive errors.
This is excellent advice, and I never knew this, that you can actually take your children for a screening even when the child starts to read, which is a very good advice. Thank you so much.
And even younger.
Okay, but how regularly should a child be screened or do these tests?
I still recommend every year, a yearly checkup. For children with with errors of refraction, if they're wearing eyeglasses already, children tend to have unstable grades. So it could be every 6 months they can do that just to check if there's a change. So they really change it. Their grade changes so fast. So those with high grades every 6 months, those without any grades or just want to know every year is fine.
Every year. Okay. So friends, remember, take your children for their screening every year. Don't forget that. Dr. Valerie, our next question coming up is how to prevent and manage dry eye syndrome.
Okay. So dry eye syndrome is the reason why it's called a syndrome. It's because it has a very broad symptoms. So you can have headaches, you can have even vomiting, dizziness, red eyes, itchy eyes. So there's a lot of symptoms that can be part of the dry eye syndrome. So first you have to find the cause. What is the cause for dry eyes? Is it um, inborn? Some patients, they just have dry eyes. They can't produce tears. So for those patients, they have to be on lubricants forever, okay, because they cannot produce tears. But that's very rare. Most of the causes are because of the work that they do. Say they work with computers. Like I told you, some of them, they forget to blink. They're so focused on reading. That can cause dry eyes. Some are always maybe swimming, not all these things. So that anything basically that can impair tear function will lead to dry eyes. So first, how do you diagnose it? Of course, we have to find out the symptoms. And then we check, us doctors, we check them in the microscope. We look for, we grade them by severity. So if it's a mild, if it's moderate, if it's severe, then we give them medicines based on the severity. So for me, I always give lubricants whenever I diagnose a patient with dry eyes. The type of lubricant, of course, will depend on the dryness. Sometimes I add steroids if they have very severe dry eyes. For those who cannot close their eyelids, there are patients who cannot do that. It's causing them to have very, very dry eyes. I usually do lid taping. There are a lot of things. So the management is very, very broad. But for most people, they can go about their lives with lubricants, eye drops.
But is there a preventive measure, like to prevent it from happening?
To prevent it, of course, first, if it's, again, it depends on the cost. Now, if you're working with computers, you'll have to rest. I can teach you, there's a rule called the 20-20-20 rule. Again, this would be a good time to show a diagram. So what do you mean by the 20-20-20 rule? So this is what you do. Every 20 minutes of computer use, so actually like what we're doing now, you have to stop for 20 seconds and stare at something 20 feet away. Why is that? What is the reason behind that? So your eyes can only contract, or your eyes can only focus for 20 minutes comfortably. So after that, you rest, you look far away to allow it to relax. And then you give it at least 20 seconds. And then you can go back to your business, actually.
Nice. Okay. So friends, remember, whenever you are on a gadget, after 20 minutes, take a break and look 20 feet away. Dr. Valerie, I remember my mama used to tell me that look at green things. And she always said that green affects the eyes and, it makes it stronger. Is that true?
Actually, it's not really the color green. It's more like maybe is it because of car rides? Did she tell you to do that while traveling? Is it correct?
Like look at the trees or leaves, and she said the green color is always good for the eyes.
That one, the colors don't really have an impact on the eyes. Maybe it's more of the distance. So we don't have a tree next to us, right? It's always far from us. So that actually is the 20 feet away that she probably is trying to tell you. And in the car, we also tell patients to look trees because the motion of the car moves. It moves fast. So sometimes we get dizzy. So I just tell them to stare at the tree. Feel. They don't move as fast as the car. They're just steady, right? So your eyes get to focus and remain.
Right. Okay. So we have the next question that has come up right now. Are there any eye problems which have increased due to the gadget era?
Yes. So aside from digital eye strain, this one is not really studied well yet. It's still being studied, but if there's a link between gadget use and myopia or nearsightedness. They said that children tend to be more nearsighted now than children before because of gadget use. But that one is still debatable. It's still being studied. But in my practice, I've seen that there's really a lot of children now with myopia or nearsightedness. So it's possible that it's true. But definitely dry eyes. So there's really
Dry eyes. Okay. Dry eyes is the number one culprit there. Okay. Coming up next, what is diabetic retinopathy? Is it very common, not just in elderly populations, but in middle-aged adults as well?
So diabetic retinopathy is when, so it usually happens with people who have diabetes. Okay? And most of the time, it occurs in patients who do not even know that they have diabetes, or those who do not control their sugar very well. Okay? Sugar can cause some end organ damage, and the eyes. We have a lot of small vessels in our eye. They're very small and they're very susceptible to damage. What else is high sugar damage? Of course, it damages our kidneys as well. Anything with small vessels. So our eyes, they have small vessels. They can get damaged. And when it gets damaged, the eye tries to repair itself by creating more vessels. So they build more vessels, but these new vessels are very weak and they break off easily, which is why it's very common in diabetic retinopathies to have bleeding. Patients with diabetes can have bleeding inside their eye. And what's shocking about this is that it is painless. They don't even know that their eyes are bleeding. They just start to realize when they lose vision. Then they come see us, and it's by the time it's already severe. So that's the problem with diabetic retinopathy. So yes, go ahead.
So what are the other signs and symptoms to help us know that a person has diabetic retinopathy?
So first, again, it's usually painless in the early stages. But patients who often complain with number one complaint is floaters. They see a lot of things swimming in their visual axis. That's number one complaint. Second, they also develop cataracts. So when a patient is around 40, that's young, and they have cataracts, we usually ask them to check for diabetes because it's not that common for young patients to have cataracts unless they have high sugar. Okay? When you have so much sugar in your body, it can cause your lens inside your eye to swell. That's what develops the cataract. What else do they have? Again, shadows. Sometimes they also have dry eyes. Some of those things. Well, dry eyes can come about with any illness as well. I mean, it's just one of the general symptoms. And then another sign, of course, is elevated sugar. So, most of our patients, they already have a result to show us. This is my sugar. This is my eye problem. And another thing I have to add, it's always a problem. Like some patients, they go through a lot of opticals to have their eyeglasses checked, and they keep on buying new lenses. And after a week, it doesn't seem right anymore. It's because the grade fluctuates when your sugar fluctuates. So you can have changes in refraction, and that's one of the signs that you have to see. It's very important.
Oh, okay. That is good information. Thank you. So, doctor, what exactly is cataract? Why does it occur?
So we all have a lens inside our eye, just like our eyeglasses. We also have that inside our eye. It would help think of our eye as if it's a camera. So our eye can focus near and far, and our lens has that ability also to change its shape. Okay? Now, when you have cataract, the lens should be clear. It should be very, very clear. So with babies and young adults and children, they have clear lens. As we get older, there's what water starts to build up, starts to swell, it starts to harden. and it becomes opaque. Okay, it doesn't move that much, becomes opaque, and it develops obstruction. It causes an obstruction of your visual axis, so it blocks your ability to see. Maybe a good analogy would be a window. So you cannot, you have a clear window, you can see outside. And then the window becomes, has a lot of scratches or becomes dirty, you won't be able to see outside. So that's a cataract. So you have a cataract, you won't be able to see outside. It's something that's reversible with surgery at most of the time.
So, are there any other signs and symptoms to know that a person has cataract?
Yes. Okay. So their number one complaint is always blurring of vision. It's always blurring. Some of them, they also notice, so they have blurred vision at far. They notice that they can see better at near. That's also a symptom of cataract. It's a very unique symptom. Another thing is sometimes the cataract isn't really fully developed. There's some areas that are clear. There's some areas that are not clear. It can cast shadows in someone's vision. So at night, they can experience glare, or even in the morning when there's light passing through. Usually when they're driving, they say na, oh, my eyes feel so tired, there's glare. It's because the light passes through the eye at different angles because of the cataract. So it refracts the light differently. So those are usually the symptoms. Again, pain is usually not a symptom. It just happens in very special cases.
And what is the right time to perform a cataract surgery?
The right time to perform cataract surgery is when the cataract is hard enough. Usually there's a grading. Again, we use our slit lamp microscope to check for the severity of the cataract. So we grade it. It has 6 stages. N1, nuclear 1, 2, 3, 4, 5, and 6. There's also another kind of grading, which I won't discuss it anymore. But when it's around grade 3, we usually recommend cataract surgery. But of course, for me, it depends on the quality of life. It's not an emergency. I tell the patients, if you're not ready to have the surgery done, it's fine. If you're still happy with your vision, then just leave it alone. But the moment assuming that the cataract is still small, but the person really feels upset, can do anything, quality of life is reduced, go ahead, let's do the surgery if it will make you happier. So that's basically it. No? The severity of the cataract and the quality of life. That's what I consider it.
And after a cataract surgery, what is the maintenance?
Well, we still have to check for refractive errors because it's not a perfect surgery. You can remove the cataract, you can still have a grade. That's very common. So we still tell our patients you might still need glasses after. Maintenance, of course, we usually give medicines after the surgery, maybe about a month of eye drops, more if it's very severe. And then we just tell them, basically that's it, glasses and eye drops. And of course, they shouldn't be going around punching people or getting punched because there's a artificial lens inside.
Yeah.
So you have to be careful with that.
Right. So, Dr. Valerie, there are many myths about eye problems and eye care. Can you please educate us a little more on that?
So I'm happy that you asked this question because it gets really frustrating. Like number one, the most frustrating myth that I encountered or have been encountering in the clinics is that breast milk can help remove sore eyes for children. Because a lot of mothers, they apply breast milk on their baby's eyes when they feel that there's some problem. You'd not ever do that because it's not, first, it's sugar, it's food, so it can promote bacterial growth. It's still milk. Okay, so that there will be, if there's an infection in the eye, it will be worse if you apply breast milk. And I believe me, this is very common practice in the Philippines. Usually the grandparents, they're the ones who tell their daughters that's the right thing. So please stop. If you know anyone who does this, the baby will really suffer. What else can I talk about? Oh, the myth that's if you sleep with wet hair, you get headaches or blurred vision. Have you heard of that?
Yes, I have. In fact, even I have been told that many times.
It's not really related. There's no contraindication to taking a bath. That's why I want to tell patients. They're always worried na, oh, my Lola said, Lola's grandmother, if I take a bath at night, I will have this, that. No, you can take a bath, it's okay. There's no, those are basically the two things. I'm not sure if you have any, have you heard any other myths I can debunk? Oh, another one, sorry. Her herbal eye drops, they're marketed now without, I have to say this because they see that there's some certain eye drops that can cure all. So cure all, I'm really telling you it's not true. There is no such thing as a cure all eye drops. There are medicines for different kinds of eye problems. So it will not cure cataract, it will not cure glaucoma, it will not cure sore eyes. You have to see a doctor to get the specific medicine. That's it, basically.
Okay. Friends, whatever eye problem it is, please go to your doctor and your doctor will tell you exactly what to do. Please do not try and do anything on your own at home. It is always advisable to go and see a doctor. Dr. Valerie, now to end our session, please advise us on how to take care of eyes in the era of gadgets. I know you did explain after every 20 minutes to take a break and look 20 feet away, but is there anything else that you'd like to advise us on?
Yeah. So so that's the number one thing you can do at home, but you also have to see your eye doctor to check if you have refractive errors. That will help you focus better. It will help you prevent digital eye strain. If you might actually need lubricants, so you have to see your doctor because that again will help you feel comfortable. It will also prevent dry eye syndrome. So those are the things that you can do apart from the 20-20 rule, which again we already explained. That's it.
Okay, thank you so much, Dr. Valerie. That brings us to the end of today's questions and answer segment. And today's session has been an eye-opener about different issues that your eyesight can face and how you can take care of it. Key points that one can take back is blinking prevents dry eye syndrome. LASIK surgery is recommended for those with stable eye grades, but still subject to ophthalmologist consultation. Annual vision screening is encouraged to prevent lazy eye or amblyopia. 20-20-20 rule, every 20 minutes spent using screen, you should try to look away at something that is 20 feet away from you for a total of 20 seconds. And friends, do consult your eye doctor if you're in doubt. Don't blindly follow any home remedies. So Dr. Valerie, thank you so much for that. It was wonderful having you with us today.
Thank you so much for having me also.
Okay, friends, so that was Dr. Valerie educating us on vision health and preventive measures. Don't forget to do your regular vision screening. It is a small investment for something that can impact your life greatly. Do share this video of awareness and help us spread the message globally. The next episode coming up is on common skin problems and how you can manage it. Do mark your calendars and don't forget to tune in on the 7th of September for the next episode of Ivy's Wellness Wednesday with an expert dermatologist. Watch this space for more details and you can send in your questions on the topic right here on this page. Do keep asking your questions and we will get the answers for you. Until then, take care, stay healthy, stay safe and stay well. And most importantly, educate and spread awareness because a better eye is a better we. This is me, Vaish, your host for Wellness Wednesday, signing off. Good night and namaste.